and the more precautions you take.
A very good afternoon and a warm welcome to all our viewers. I am Darshika, member of the clinical engagement team at DocPlexus. As you all are already aware that this month of October is a special celebration of DocPlexus completing 8 glorious years. I take this opportunity to thank each and everyone on behalf of my fellow DocPlexians for your constant support and love over the past years. The DocPlexus team humbly invites you to be a part of the celebration this month and witness the launch of our brand new segments, the all-new MasterSeries, DocPlexus Surgical Suite, ACME, MediTV, DocPlexus Essentials, and much more. This time, we go beyond our 99 medical specialties in our special 8YC MasterSeries session. These MasterSeries sessions are planned to discuss the nuances of specialties like genetic medicine, hyperbaric medicine, nuclear medicine, public health, burns, and microvascular surgery. So today's session is focused on the essentials of radiation oncology, where experts of the field will throw some light on the specialty, its role in other medical specialties, academics, career opportunities, and its future in India. So stay tuned till the end, where we also have a brief Q&A session where the panelists will take up questions from our live audience. So to begin with, I now would like to invite our two speakers, Dr. Ramesh and Dr. Nagaraj. This session shall be moderated by Dr. Sasikala. I would now request Dr. Sasikala to take the session ahead.
Good evening, Dr. Nagaraj sir and Ramesh sir. So here I thank DocPlexus for inviting the professor, Dr. Nagaraj and Dr. Ramesh to participate in the 8th anniversary of DocPlexus, which has scattered medical professionals in the platform of sharing knowledge around. It has covered 380,000 doctors in allopathy. So we will be discussing a series of sessions with the most upcoming therapeutic areas, which people are not, young doctors are not much aware of that. So that today the master session in radiation oncology. So here we have Dr. Ramesh and Dr. Nagaraj, who are the legends in radiation oncology. And Dr. Ramesh, he is emeritus professor in radiation oncology in HCG group of hospital, and he completed his MD in oncology in Bangalore Medical College and nuclear medicine in Baba Atomic Research Center. And he is a fellow of International College of Surgeons and fellow of Indian College of Radiation Oncology. And his special areas of interest are in HDR brachytherapy, chemoradiation, conformal radiotherapy, and head and neck and gynec oncology. And he is an editorial board of Journal of Cancer Research and Therapeutics and Contemporary Brachytherapy of Polish Journal. And he has been awarded Professor P.K. Haldar Memorial Award. He was the chairman in ICRO and the national president in AROI in 2010. And he have a lot of national and international publications. And now he is the director of radiation oncology in HCG group of hospital. A warm welcome to you, sir, for this evening session in radiation oncology. And I invite Dr. Nagaraj G. Puligal, who is the chief and division of radiation oncology at Nanavati Hospital in Mumbai. And he done his MD in radiation oncology in All India Institute of Medical Science, New Delhi. And he has been worked in Tata Memorial Hospital and Kidwai Memorial Institution of Oncology at Bangalore. And he has served in many government bodies like AERB. And he's a founder member of Society for Cancer Research and Communication. And he's the president of Indian Association of Hyperthermic Oncology and joint secretary of Indian Society of Oncology. And he has a lot of publications in the national and international, and edited 3 books in radiation oncology. And he's a fellow of Indian Academy of Sciences and Indian Institute of technology, and he's a member of Astro, Arroy, and many international oncology associations. A warm welcome to you, sir. So today, for the next 1 minute, as such, how it has been seen by the public and by the doctors' fraternity. So to start with, I just put a question to Dr. Ramesh. So why you feel radiation oncology is a very important specialty? Ramesh, sir?
Yeah, that's it. Thank you, Dr. Shikara, for introducing us. Today, if you take a health scenario as such in the world, and particularly so in the developing countries, like India, the cancer disease plays a major role. And so if you look at the chronic diseases, and this is one of the chronic disease, and which is occupying a major health concern to the country. And the backbone of the treatment and for this disease is radiotherapy. And we, and being a radiation oncologist, and we specialize in that science, obviously, and its importance is very high and in the ranking.
Sir, Dr. Nagraj, sir, you want to add to it about your views?
Yes, that's right. Both of us, like myself and Ramesh, started a journey in radiation oncology when radiation oncology was considered a palliative treatment, wherein patients were dying, they would be sent for a radiotherapy. And our journey reflects the progress in technology. And from those days, when it was something palliative, to today, it is you can say that it can be curative in many of the cancers, like say vocal cord, or it could be prostate, it could be cervical cancer. So many of the cancers today can be cured or controlled for a long time with radiation. As a result of which, one of the greatest advantages, when you talk about surgery, you need to have pair of good hands. And we don't really have enough surgical expertise in the country, whereas we do have radiation oncology. We need to have more, but and in itself it can be curative in many of the anatomical subsites where cancer hits the patients, and especially when there's no surgical facility and the surgeon is there, radiotherapy can be effectively substituted for surgery. And in a country like ours, wherein the expertise is very heterogeneous, we should not compare ourselves, like I'm in a fancy place like Mumbai and Ramesh in Bangalore, but most of you just travel 200 kilometers down the line, probably you'll have radiation oncology, but not as much. And technology has transformed tremendously. So I think all these things make radiotherapy a very important armamentarium. And it's always a multidisciplinary approach, and radiotherapy plays a crucial role in cure, control, and palliation.
Yeah, thank you, sir. As you rightly said, radiation taking a major role in organ preservation in head and neck, where we don't have surgical specialty in the tier 3 cities and all. Tier 1 or tier 2 cities, where the radiation machine is there, people will get benefit without a surgical specialist also. Ramesh sir, could you tell us about your journey so far in radiation oncology from your beginning of your career?
Yes, Shishikala. What Dr. Nagraj said, is to put it, in our vernacular language, and we joined the era when, give a radiation kodi. That means, give a little bit of radiation, and that's it, because you can't do anything for that patient. So that is the kind of era that we joined. That's back in 75, and the 75 December was the day when I joined as a lecturer in radiation. Then it was called the radiology, registrar radiology in the Kidwa Memorial Institute of Oncology. And that was a combined department at that time. The both imaging, that's a radio diagnostic department, nuclear medicine department, and a radiotherapy department. All the three departments put together, it was one department. And those were the days when we joined. And just then, the cobalt, was its in youth, and quite a lot of the institution were there, and we too had a cobalt era. So therefore, I developed in a era when the cobalt was really in its prime time. And then came after almost 80, 90s, and the first linear accelerator when we acquired in Kidwai and a Memorial Institute. And that was just the beginning of 90s and 2000, and the era of the linear accelerator came into picture. And we learned at that time. And much more than that, I must really acknowledge the development of the imaging science at that time. Both in terms of a CT scanner was in use, and so that gave the impetus and for the technological development in the radiation oncology, and it improved and over a period of time into starting from a three-dimensional radiation therapy to IMRT, intensity modulated radiotherapy, and further, and the technologies that we see, the latest technology also came into picture from 2000 onwards in a more commercial way. So all this, the era that we have seen, and that is in terms of the external radiation that I'm talking about. But if I go back to the at another wing of the therapy called brachytherapy, and we started our work and with the radium needles. And radium needles, and we used to use it in Victoria Hospital, and that's where the journey started. Then we moved to the cesium needle, and thereafter by about 2000, and iridium wires started coming in. In other words, I have not seen in the external radiation the era of a deep X-rays or pendulum therapy units, but except seeing them as a museum of pieces in our hospital at that point of time, but grown and in the era of cobalt, moved to linear accelerator, and then further advanced to the current technology like tomotherapy, cyberknife, and whatnot. So that is the kind of a journey that we had almost for 45 years. Thank you.
Thank you, sir. Yeah, thank you, sir. Thank you for sharing your experience. Nagraj, sir, we want to hear from you. How about your journey, like Dr. Ramesh?
Yeah, I think my journey with Ramesh and that of Ramesh overlaps fairly, because I think we are both the same age. And of course, as you rightly mentioned, I was in All India Institute of Medical Sciences, and I also worked in Tata Hospital. When I was doing my diploma in gynecology, I was in Tata Hospital, and we still had something called an auto voltage. And Ramesh, I guess, saw it in the museum, but I saw it in operation. By the time I came back to Tata again in the 1980s, it has gone. So I have seen the entire gamut of telecesium, auto voltage to present day technology, which is extremely sophisticated. And this is we are not at the plateau. Maybe there is a diminishing return, but the technology is growing very fast. Be it in protons or carbon ions or flash radiotherapy, and a lot of imaging modalities, predictive assays, radiation sensitizers, and the emphasis on radiation protectors. Exceedingly exciting. Not just the technology, but the whole science of radiation oncology or radiation therapy and radiation biology. I have been a witness to bullet carts. I've traveled in the bullet cart when I was a child, and I see all the jets, flying all over the sky. Same with the story with radiotherapy. I started with telecesium. I have seen telecesium and auto voltage in action, and now there are going to be two centers for protons. I believe there's going to be a center for carbon ion in Delhi. So this has been exceedingly exciting. So today, and it is changing. It's changing fairly rapidly. Still we're not reached the plateau. I don't know whether the outcomes are getting better. Definitely, side effects are much less from the era of radiative therapeutics to, as I said, control care and of course, foundation. We've reached there very effectively, and to me, very exciting. the story is not over as it.
Thank you, sir. As you say, you feel pride to be in radiation oncology when you see your child, which is crawled and now it has become grown up to a big, big man. Like with the technology, we have all the higher end machines now, like proton therapy or particle therapy, all those things. We feel pride to be in this profession. And many of the medical fraternity think radiation means it is exposure of the doctor to radiation when we work in the department. So many of them don't know that now everything is remotely controlled, and we don't have any occupational hazard or radiation as such when we work in the department. I think people should come forward and take this profession, and we will hope more people take this profession and do their best in oncology. So I like to put this question to Dr. Ramesh. Sir, what is the scope of practice of radiation oncology and the career opportunity for the young people in the current situation? Ramesh, sir?
Yeah, scope of radiation oncology, what you are asking is what is the job opportunity, and if one wants to go in the line of employment. And the other area that you will have to look for is the self-employment or entrepreneurship, and one can take into. So not only that, this is regarding the service aspect. But if you take the other areas also, like a research aspect and a teaching aspect and administrative aspect, so there are various areas one can enter into, and even after becoming a radiation oncologist. So the first priority we will take that is the priority of a service aspect. In India, and it's about 40%, around 40% of the required gadgets are available right now, but there's another 60% is really required, more required to come. So therefore, the question of getting more number of equipment means there's more, the professionals are required. And today we have around 4,000 radiation oncologists, of which maybe active and practicing people maybe around 3,000 to 3,200, and whereas we need about 7,500. So there is quite a depth of the service required, and by the oncology, by the society, and by the radiation oncologists, that will go for another 10 years. What the problem that we are seeing is most of these equipments are in the tier 1 and tier 2 cities, and that's to percolate into the district or tier 3 cities, and that is where the congestion that is taking place. The moment radiation oncologists are ready to go out and the units come up in the district places, I don't think for another 10 years there's any issue of getting employed, or even being self-employed or being entrepreneur in this service aspect is concerned. That's one. Number two, as I said, regarding the research issue. Quite a lot of research work is going on in the field of radiation oncology, because it's a biological, the effect that occurs, and there are many of the drugs are being discovered which interact synergistically and with radiation. So and that area is also quite wide open and for the radiation oncologist to take. Similarly, in the teaching, when you need another 4,000 radiation oncologists in our country, obviously there's a need for teachers. So all these areas and shows there is a good future, at least in the near next 1 decade, and for radiation oncologists.
Thank you, sir. Thank you, sir. Nagraj, sir, we want to hear from you. What is the scope in radiation oncology for young people?
Yeah, right now, as Ramesh rightly said, I think in India there's a fair bit of scope and it's expanding. Almost every year there are another 10, 15 new centers which are cropping up with advanced technology. To give an example, just from 150 kilometers from here, there's a small town called Wapi. There's a new center that has come up. A small town like Navsari has 2 centers. which means there is a job opportunity. There are, however, certain challenges. I mean, if you have an entrepreneurial spirit, it's a very capital intensive, so it may not be as easy as just buying and setting up a small little nursing home or so on and so forth. So if you are fiercely independent and entrepreneurial, you may find it a little challenging, but not impossible. But as we have seen Ramesh himself or a few others making a consortiums to start their own center. I think a lot of people do feel a little, averse, because not just because of the radiation phobia, but because it becomes institution dependent. So you got to be a part of a tertiary hospital, and it does not appeal to some of the doctors. But otherwise, and I think in India at this point of time for next 10 years, growing, jobs should be available. And I think Ramesh drives BMW. That says it all.
Thank you, sir. Thank you, sir. As rightly said, for the young generation, there is a lot of scope in research in oncology, because it is the research is ever ending in oncology, and the academic part also. And people will get more opportunity, because government also trying to open in every medical college an oncology department with machines. So I think in future, both from the private and the government side, we get lot of opportunities in radiation oncology. So coming to our next question, Ramesh sir, could you shed light on what is the training involved as a resident in radiation oncology for the postgraduates?
Yeah. After MBBS, when you apply and for the residency program or the degree program, there are two streams are available at present in India. The first one is the university-based one, and that takes you to the degree course, let's say MD in radiotherapy or radiation oncology. And earlier, and we used to have the diploma, but now diploma courses are slowly being phased out. Hardly one or two institutions they have now, and even that's also getting close. And the other stream that we have is DNB in radiation oncology, and the number of seats are also increasing, and that's also another stream, and that's available by the National Board of Examination, which is conducting. So those two streams are available. And coming to the duration of the duration that's available, and for that is a 3 years course, and post the MBBS. And this 3 years and course makes the person undergoes the various basics of the anatomy, physiology, whatever that he has learned as applied to radiation oncology, and then he also has to learn the radiation basics of physics and application radiobiology, and its application in treating of the patient, various technique he learns. That is, as I said, there are two wings in that. One is the external radiation, which he learns, and the second one is a brachytherapy, which is a more a knowledge and a skill based, which he has to learn it during his residency period. And after having done that, and of course he undergoes the examination at the end of that, and then he is a qualified radiation oncologist. And but to me, and just being the MD alone may not be sufficient, and generally, and he applies for a senior residency, and gets into a further training, and that could be in the form of a fellowship in a particular area that he wants to learn, or even a general knowledge and learning the current latest technique, and he learns those things. So those are the areas that we have at present. Even a DNB course is almost similar to this, and which is in tune with the MD radiation oncology course.
Thank you, sir. Nagraj sir, from you, we want to hear what are the procedures or the training the postgraduate undergo in radiation oncology?
I think Ramesh has covered it all, and only one probably point which I will add is One good thing is we have what we call the DNB, which is available, like say for instance, in Ramesh's HCG. Many of the private hospitals who are exceedingly well equipped can also give offer this postgraduate degrees, and because there are certain, like in North especially, there are institutions, they're all recognized government hospitals and so on and so forth, with very poor equipment, poor technology, because it's technology driven. And I'm very happy that institutions like HCG or a few others offer DNB, and that has made the training accessible, the top class training on a top class technology accessible to many more students than it was before. And that's a good thing. And I think Dr. Ramesh is very comprehensive in educating everyone how it goes.
Thank you, sir. So even we have seen people coming post MD for fellowship to corporate hospital to learn all the latest technology. Because in the medical college, they are exposed to only minimal technology. So we have seen the postgraduates coming for fellowship to learn all the higher end technology like stereotactic radiosurgery, stereotactic body radiation therapy. So we move on to the next question. Ramesh sir, what do you think about the economic reality of medical education and the career in radiation oncology? How economically it is helpful for the postgraduates when they take this specialty?
First of all, somehow I'm not very comfortable and with the word economic, and when you wants to be in the service sector, and when it becomes a comparative one, then you are only fighting with what the other course is offering you or how much you are going to earn. I don't think that should be the criteria in assessing or taking any course. Then it's better and be a non-medical person and earn money, in some other course. That's much easier than being in the medical. But here, being in the medical, what we should really know, we got to have a decent living, and in commensurate with the society that we are living in, and that is where our focus has to be, rather than comparing the economics with any other person who is prospering, be it in our own medical community, or even otherwise. So if I take that as an aspect, to decide, radiation oncology is one of the very good specialty, and which gives you a 5 things actually, which is very satisfying. One is you take care of the patient, and you really give a care what is really required, or a relief that is required to the patient, and very satisfying one. And number 2, you're educationally you're quite happy, and you have got your one of the best education possible in the medical field. And the third, and you are serving the society and in a manner and which is really suffering from with the increasing the cancer patients and being there, and you are compensated adequately, be it in the government service or even in the private service. You are adequately compensated. I'm not talking about the very, very highly, you are remunerated, but adequately compensated, and in that aspect. And if you take the other aspect of research field, and you are there, in the right field and to do a research. So all these 5 aspects are taken together, and economics comes the least part to talk about how economically, because it becomes a comparative statement. Look for how well I can live in the society that I live in. Is it giving me enough satisfaction and the way that I want to live here?
Yeah, thank you, sir. You rightly said economic is not a priority in the medical profession. Nagraj, sir, you want to add anything on this?
Well, I understand the sentiments of what Dr. Ramesh said, but if you can allow me to say it in just one line, I can, because I don't know the recent cost, etc., etc. I can just say that it's a moderate input, moderate return branch, and you don't compare yourself with a very fancy fellow doing CABG, 10 CABG every week or something like that. But at the same time, it's, as I said, look at Ramesh and see and see how most of them have been successful in every aspect of life, be it economic or intellectual. It's exceedingly satisfying. You can do research, you can earn a fair bit of money. But if you're looking at a jackpot, this is not.
Yeah. Thank you, sir. So I move on to the next question. Ramesh sir, what do you think this radiation oncology training for the postgraduate, how they prepare themselves as a leader in healthcare in this training?
Yeah, the preparation of a leadership, for the healthcare industry, really it is the self-motivated one. It is not, forced, the designation that you get. If you are talking in terms of the government jobs and they have the leadership, hardly any people are from the radiation oncology are very, very fond of to go for an administrative post and to be a leader there. But there are few, not that there nobody is there, but there are very few, but they are more interested in the clinical work rather than taking a leadership post, in that aspect. But the leadership can also be in the society building. But if you talk about the society building, today and in the healthcare, quite a lot of people are taking interest in getting into the entrepreneurship. There they build their leadership and how do we go about in being an entrepreneur in the society. And it's like I call it as a worthwhile investment in the society building. That kind of a leadership that we are seeing with the generation that's coming.
Yeah. Thank you, sir. Nagraj sir, you want to share anything on the leadership quality they developed during the training?
Well, I think I keep telling all my youngsters, first of all, think of yourself as an oncologist and make radiation oncology your subspecialty. And dealing with all this very expensive equipment and so on and so forth, the leadership should become next nature to most of the radiation oncologists if they follow this maxim that first an oncologist, then a radiation oncologist. And as I said, there are so many groups and individuals who also have become entrepreneurs in oncology. That goes to show that many of these people not only have an innate ability of being an entrepreneur, but the training itself perhaps enables them or equips them or trains them to be leaders and entrepreneurs and opinion makers.
Yeah, thank you, sir. Actually, recently in the Indian Cancer Congress, which we conducted in Bangalore, in that the Federation of Asian Radiation Oncologist Association, FARO, they conducted a 4 days or 5 days program of leadership quality, how to develop. I think now even in the conferences, they motivate oncologists how to develop themselves as leaders in healthcare. Basically, it should come within. I agree. So this is the last question of the session, sir. So Ramesh sir, what do you think the future of radiation oncology is so bright? We feel so. What is your thought on that? How bright it is, the future of radiation oncology?
Yeah. As we have been discussing, whenever we talk about the radiation oncology future, and we must talk about it in all the 4 spheres that it has. The one is a service aspect of the radiation oncology, and certainly there's an unmet need and in India in all the sections of society. So therefore, there's a good amount of the service one can render, and so therefore, that in the service aspect, it's good, and the quality of the service that we are concentrating right today, and which is very good. In the sense that it's not just a cure or a palliation that we are looking at, but how best you can send the patient after the treatment back to the society as a normal person, and that's where we are concentrating. And from the days of when we were treating over a long period of time, and now we are reducing all our treatment time and slowly into the hypofractionation and even further, and we are reducing it and making it within a short period of time, and the whole treatment can be completed, and that is where the future is going. And also in that field, and adding the radiation or combining the radiation with other modalities like biologicals, hypothermia, or even the surgical, medical, all that. How do we really do that? Combine them to a synergistic effect, and is the way forward that we are looking from the service point of view. And coming to the teaching point of view now, and what I said earlier, from the MD in radiation oncology, now we are specializing into DM radiation oncology. That has already been introduced, and by the government of India, and there are one center has already started, DM in radiation oncology. Probably many more centers will start in the days to come. And there are quite a good lot of the young doctors are looking to enter into medical oncology, and to further enhance their capability in oncology. So that's in that direction. And in the research field again, and a good number of our radiation oncologists are entering into research field to make the radiation and more effective, and how best and we can take it further, and even in that field. As for the teaching is concerned, and the future is it is not limited to university. That is where we are going. Today, if you are talking here, and these kind of webinar based, these kind of virtual based platforms are coming up, and quite a lot of associations are taking academic interest in teaching. So therefore, a good amount of academic interest has been infused. So future is very good, and in the right direction rather, and I can say, and I'm quite happy about that.
Yeah. Thank you, sir. Nagraj, sir?
Well, good times are here, and I think it's going to get better as the days come. My only hope, along with Ramesh and a few others, is that hypothermic oncology also gets becomes popular in India, like it is in some of the Scandinavian countries. As I said, good times are here already, and it's going to get better.
Yeah. Thank you, sir. 50 years back, 50 years back, we never thought radiation oncology will flourish and come in this beautiful way. Maybe in another 10 years or 20 years, it will come in a more established way, and the future is always bright. And we encourage all the young doctors to come into this radiation oncology and do their service. Thank you, sir. Thank you for sharing your valuable time with Doc Plexus.
Thank you, and from my side, and Dr. Nagraj also will join me, and Shashikala, and we appreciate the Doc Plexus and Dr. Shantil and with your group, and having taken the interest to see that radiation oncology and the need of the society will be enhanced in the days to come. Thank you so much.
Thank you, doctors. On this note, we would now like to close today's session. To the audience, thank you so much for your interaction and loyal viewership. We hope this shall help the doctors explore different avenues in the ever-changing field of medicine. In case of any more questions, please feel free to drop them in the comment section below. We would be happy to get the answers from our experts here. Also, a big shout out to the Doc Plexus internal teams for bringing about revolutionary topic discussions for our audience during this 8YC celebration. Stay tuned for the 8YC exclusives on medical negligence and medical legal guidelines tomorrow 6 p.m. onwards. I will see you all again, and until then, stay safe and have a great evening ahead. Thank you for joining today.